As a dentist, one of the most common questions I get is this: why do my teeth hurt after I use whitening strips or whitening trays? And it's usually sharp, sudden pain, especially when drinking something cold or breathing in cold air. And while this kind of sensitivity is common, it's not always harmless. In this video, I'll explain exactly what's happening inside your teeth when that pain shows up, and the mistakes that could be making it worse, and what you can do right now to fix it, and also when it's a sign of something more serious. But first, we need to understand the signs behind the whitening pain. So most whitening strips contain hydrogen peroxide or carbamide peroxide, typically ranging between 6 to 30% in concentration. And these bleaching agents, they penetrate the outer layer, which is your enamel, and they break down the deeper stains inside the tooth. And here's what's actually happening at a microscopic level. So your enamel has millions of pores, and the dentin, which is the layer underneath, has thousands of tubules. Imagine them like tiny straws leading directly into your tooth's nerve center. Now, when the peroxide reaches these tubules, it creates a cascade of reactions. So first, it oxidizes the stain molecules, which breaks them down into smaller colorless compounds. But simultaneously, what it does is the organic matrix within the enamel starts to swell, and that opens up the tubules wider. And the peroxide temporarily dehydrates the tooth structure. So your teeth are about 4% of water by weight. And when they lose that moisture, your teeth or your tubules basically become more exposed, creating a direct pathway for the stimuli to reach to the nerve. And what you feel as sensitivity is actually your tooth's nerve responding to this increased exposure. Cold temperatures, air, sweet foods can travel now through these open pathways and trigger pain signals. And this process typically peaks at 24 to 48 hours after whitening and can last anywhere from a few hours to several days, depending on your individual tooth structure and the concentration of the peroxide used. Not everyone experiences the same level of discomfort, and there's a biological reason for this. So your enamel thickness varies significantly, and some people have naturally thin enamel, as little as 0.5 millimeters. And others have thicker protective layers up to 2.5 millimeters. And if you ever wondered why your friend who used whitening strips or whitening gels didn't have an issue while you were in agony, it often comes down to these structural differences. So it could be down to enamel thickness. Thinner enamel means peroxide reaches the dentin faster and in higher concentrations. Dentin tubule density. Some people have more tubules per square millimeter, essentially more pain pathways leading to the nerve. And even if you had previous dental work, so if you had fillings, crowns, had orthodontic treatment in the past, your tooth structure might be compromised in ways that can increase the peroxide penetration, or even the age factor. So as we age, our enamel naturally wears down, and our dentin tubules technically become more exposed due to gum recession and normal wear patterns. And even genetics, your pain threshold and nerve sensitivity are partially inherited, and some people naturally have more reactive dental nerves. Now let's dive into the most common mistakes that turn mild sensitivity into serious discomfort. And mistake number one is brushing right before or right after whitening. So your enamel temporarily softens during the whitening process, a phenomenon in dentistry known as enamel demineralization. And if you brush within 30 minutes before or after the whitening, you can create microabrasions and you can increase the peroxide penetration dramatically. So wait 30 minutes or ideally an hour. And mistake number two is using the strips or the gels without any recovery periods. And your teeth basically need time to remineralize and rehydrate between treatments. And even if the package says for daily use and you're experiencing any sensitivity, switch to every other day or maybe even every third day, because the cumulative effect of the peroxide exposure can actually overwhelm your tooth's natural repair mechanisms. And mistake number three is whitening over untreated dental problems. And this is potentially dangerous because if you're using whitening strips on teeth with cavities, worn fillings, hairline cracks, or exposed roots, is it allows the peroxide to bypass the protective enamel layer entirely, and it can enter the nerve chamber directly. So this can cause pulp inflammation, it can even cause the nerve to die, it can create all sorts of problems, infections, etc., etc. Mistake number four is using abrasive toothpaste during whitening. So many whitening toothpastes contain silica and other abrasives, and using that during a whitening regimen can create microscopic scratches that allow for deeper peroxide penetration. And mistake number five is eating acidic foods after whitening. So post-whitening, your enamel becomes softer and more porous, and consuming citrus, vinegar-based foods, or soda can cause additional erosion and can prolong the sensitivity. And mistake number six is ignoring the fit of your strips or your whitening trays. And poorly fitting strips or whitening trays can cause uneven peroxide distribution, and that can lead to some areas being overexposed while others remain untreated. And that can end up creating patchy results and unpredictable sensitivity patterns. Now here's what I recommend if you're experiencing post-whitening sensitivity. First thing is switch to a desensitizing toothpaste. So look for something with potassium nitrate or stannous fluoride because they help block the pain signals and rebuild enamel. And for the best results, apply a small amount to the affected area overnight and leave it on. Make sure you don't rinse this. And the second thing is try and use a fluoride mouthwash. So switch to a non-alcoholic fluoride-based mouthwash twice a day, and make sure you use that before you brush, so you don't rinse away the toothpaste. And also make sure you stop the whitening until the pain fully resolves. So even one more application can actually push your teeth over the edge if they're already irritated. So make sure you give them some time. And avoid anything acidic or cold for at least 48 hours. Things like sparkling water, lemon, citrus fruits, tomatoes, and ice cream. And also make sure you stay hydrated. So your saliva is your mouth's natural defense system against sensitivity. Now, most whitening sensitivity is usually harmless and short-lived, but sometimes what feels like just sensitivity could actually be your tooth warning you of something deeper going on. So here's how to tell the difference. We're going to split them into two categories. So normal sensitivity looks like sharp, brief pain that lasts a few seconds, triggered by cold, air, or sweet foods, and usually affects several teeth at once and can get better by the day, gets better each day, and also responds well to desensitizing toothpaste and fluoride. And the symptoms that I would usually be a bit more concerned about and I'll try and pay closer attention to are pain, for example, that lingers for 30 seconds or more, especially after the cold is gone, or pain that happens spontaneously without any trigger, or pain that wakes you up at night, and pain that is usually isolated to a single tooth, or throbbing or pulsing sensation, especially in the rhythm of your heartbeat, or pain when biting or chewing, particularly if it's sharp or if it's getting worse, and if there's swelling or gum tenderness around one tooth. And these symptoms could be signs of irreversible pulpitis, a cracked tooth, or even a developing abscess, none which can be fixed by whitening products or sensitivity toothpaste. Now, when should you see a dentist? If the pain is severe, worsens over time, or hasn't improved 24 to 48 hours after, it's time to stop the whitening and call your dentist. And the earlier you catch the issue, the simpler the treatment, whether it's a minor filling or protecting the nerve before it becomes infected. And whitening should never cause pain that keeps you up at night or make it hard to eat. And if it does, your tooth needs attention and not more peroxide. Now, there are certain individuals who I would classify as higher risk and need specialized approaches. For example, teenagers or under 18s, because they have developing teeth and their teeth have larger nerve chambers and thinner enamel. The pulp is usually more reactive to the peroxide, and that can make sensitivity more likely and potentially more severe. And also pregnant and breastfeeding women. So at the moment, there's no definitive studies that show harm, but peroxide can still be systematically absorbed. And most dentistry guidelines recommend avoiding any elective whitening treatment during pregnancy. And also people with eating disorders, because frequent vomiting can cause acid erosion on the teeth, making the enamel thinner and more permeable to whitening agents. And also orthodontic patients, and that's because braces create plaque accumulation patterns and pressure points that make the whitening unpredictable. So wait until your treatment is done. And also people with autoimmune conditions. So conditions like Sjogren's syndrome reduce saliva production, compromising the mouth's natural defense mechanisms. And thank you for watching. I'll see you in the next one.